Here at the Tom Baker Cancer Center, and we are talking about the Enbridge Ride to Cure Cancer. And the captain, or one of the captains of an amazing team, is joining us right now, Dr. Henning. Dr. Henning, first give us a little bit of background on how you got involved with the ride.
Thank you so much. And yes, so last year, Michael Sincha, the CEO for the Alberta Cancer Foundation, came to our center and asked that if we put a team together that we can raise money for our center, and that's when we started last year.
Wow. Now, you guys were able to raise a lot of money last year. How much did you raise?
We raised $100,000.
$100,000. And what is your goal for this year's ride?
This year, even better,
Yeah.
250, have a $250,000.
Wow, that's a lofty goal, but something tells me you guys are going to do it. Now, it's really interesting who's on your team. Who makes up the team of 72 riders, I believe?
Yes, so I share the co-lead with Mike Civitella, who's the executive director for the Tom Baker.
Okay.
Also, Carla Wallace, she's a neuroradiologist here at the FMC. And then 69, so we're 72 in total. Professionals, mostly medical, but also non-medical professionals, so engineers, lawyers, accountants, housewives, and we have 5 cancer survivors on our team as well.
Wow. Now, what is the name of your team again?
The Tom Baker Cancer Conquerors.
The Cancer Conquerors, and that makes so much sense because lots of times people get involved in these types of cancer fundraisers and aren't really sure where the money goes. But talk about how you guys differ in that way.
Yeah, so the Enbridge Ride to Conquer Cancer benefits the Alberta Cancer Foundation.
Right.
However, our team is a bit special in that Michael Sinchak asked us and invited us that if we raise the money and come up with a team, the money goes directly back to our cancer center and specifically our clinical research unit. So it trickles down to patient care, where patients have options for potentially better treatments because there's potentially more trials they can participate in. And this is above and beyond the standard of care. So the money actually reaches the patient here in Calgary.
So patients that you guys see every day are actually going to be the ones benefiting directly from your ride.
That's right. If they participate in a clinical trial, a human trial, say for instance a phase 3 clinical trial, yes, they will see the money.
Wow, and that is really where we want to get to, isn't it? Increasing the clinical trials. That's how we're going to beat this thing, isn't it?
Absolutely. I think, able to conquering cancer, we have to be very specific in systematic, well thought through, methodical clinical research. And it's maybe a step at a time, but we'll get there.
Okay, and that's what we said. There's a lot of medical professionals on this team, but pretty much everyone has been touched in some way by this disease, haven't they?
Absolutely. Most people, including myself, my family, my wife. So yes, we're all doing it for our patients, survivors, and researchers.
Okay, well, thank you on behalf of someone else whose life has been touched by this disease for getting out there and raising this money. If people want some more information and how to directly give back to your team, what's the best way?
Yeah, so go to the website at conquercancer.ca. You can /go/TBCC, or just call the number at conquercancer.ca and just go to the website and donate to one of our team members.
Okay, thanks, Dr. Henning.
Thank you so much for having us.
You're very welcome. We're here talking about the Enbridge Ride to Cure Cancer at the Tom Baker Center. We're back with more Go Calgary right after this.